Are you fed up with lectures using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, this channel will provide a simple way of teaching emergency medicine in layman's terms. Hi everyone, welcome back to my channel. Here on Emergency Medicine on Demand, I go through various patient cases in a very simplified manner. I do one case per episode where I discuss the patient's condition, signs and symptoms, and course of treatment in layman's terms. Yes, you heard that right. This is not the type of channel where you have to pause the video to look up a word. I am not trying to look smart here. I am teaching you in the manner that I wish I was taught in. So, if you hear a big word, you can be confident I will be going over what it means. One last thing before we get started on today's case. I always share a motivational quote at the end of each video. Life can be tough sometimes, so I hope this simple gesture can change your outlook. And now, without further ado, pay attention. Today's case is on myocardial infarctions, which is a fancy word for heart attacks. What is a heart attack? A heart attack occurs when blood supply to the heart is blocked. Since blood carries oxygen, when blood supply is blocked, your heart will not be receiving oxygen. This is very dangerous because if it is not treated, and the heart continues to not receive enough oxygen, the heart muscle will begin to die. After all, this is the same as what would happen to any part of our body if it is not receiving adequate oxygenation. But why is there blockage in the first place? Heart attacks are usually caused by atherosclerosis, which is a fancy word for the accumulation of plaque on the artery walls that can potentially cause a blood clot, which you can imagine as a bunch of particles sticking very closely together and forming a barrier against entry. Now that we understand the patient's condition, let's go over the patient's symptoms. Some of the signs you would see in a patient having a heart attack include intense chest pain that may feel like pressure, tightness, pain, squeezing or aching, unbearable pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly, cold sweat, fatigue, heartburn or indigestion, lightheadedness or sudden dizziness, nausea, and shortness of breath. Now, how is this treated? Well, there are two instances we will discuss. If you were a bystander and you watched this happening, we will go over what you need to do at the scene. Then, we will also cover how this is treated at a hospital. For the bystander scenario, you would do the following. Call 911, advise them to chew on a 325 milligrams aspirin tablet, and of course stay with them until help arrives. However, it is crucial to ask them if they are allergic to aspirin before doing so. It is also important to mention that patients may have been prescribed nitroglycerin. But nitroglycerin is for symptom relief and would not tackle the underlying cause of a heart attack as aspirin would. So, it is aspirin they should be taking as a priority and not nitroglycerin. For the hospital scenario, you would do the following. You would confirm the heart attack diagnosis by doing an EKG. An EKG is an electrocardiogram test that checks the heart's activity for unusual rhythms. Other ways of diagnosing a heart attack include, but are not limited to the following. A blood test to look for troponin, which is a chemical released after a heart attack. A coronary angiogram test, which uses X-rays and contrast dyes to allow you to visually see any blockages. A CT scan, which stands for computed tomography, and is pretty much a scan to see the heart. A heart MRI, which stands for magnetic resonance imaging, which will simply show an image of your heart using strong magnetic field. After diagnosis is confirmed at the hospital, here is the treatment plan. First off, we have oxygen and medications. Supplemental oxygen helps raise oxygen levels. Medication, such as aspirin and nitroglycerin, may also help relieve symptoms and improve blood flow. There is also reperfusion therapy. Reperfusion means reoxygenation, or in other words, restoration of blood flow. Medications such as thrombolytics, which will be covered on a different video, can dissolve the clot. There is also a procedure called percutaneous coronary intervention, PCI for short, which involves inserting a catheter into the blocked artery to open it and restore blood flow. Think of the catheter as a skinny straw that is inserted in the body. Finally, we have supportive care. Additional interventions may include pain relief medications, intravenous fluids, and close monitoring of vital signs and heart rhythm. Now let's go over what is aspirin. Aspirin falls under the drug class of salicylates. Salicylates are natural chemicals created by plants. They are found in fruits and vegetables and help protect plants against disease and insects. So, it is no wonder that salicylate extracts have been used on humans to do the same. Salicylic acid, more commonly known as aspirin, relieves pain and inflammation. It works by stopping the production of certain natural substances that cause fever, pain, swelling, and blood clots. Moving on to what is nitroglycerin. Nitroglycerin falls under the drug class of nitrates and works by promoting blood flow, hence why it helps with the pain. It comes in many forms, with the most common being the sublingual route, which is referring to placing the tablet under the tongue and waiting for it to dissolve. As promised, here is today's quote. If you are struggling, you deserve to make self-care a priority, whether that means lying in bed all day, eating comfort food, crying, sleeping, rescheduling plans, finding an escape through a good book, watching your favorite TV show, or doing nothing at all. Give yourself permission to put your healing first. Quiet the voice telling you to do more and be more. And today, whatever you do, let it be enough. Feel your feelings, breathe, and be gentle with yourself. Acknowledge that you are doing the best you can to cope and survive.